Hello, I'm Tammy Weicker-Adkins, Public Information Officer for Tulare County Health and Human Services, and with me today I have a couple of guests. First, we have Chaz Felix, Homeless Initiatives Program Coordinator, and Christina Jones, who is an HHSA analyst who is currently working with Chaz. And we're discussing today our homeless community members and those who are at risk for homelessness during this time. So I have several questions to pose to the both of you, and thank you for being here.
Sure.
First of all, what is the situation overall for our homeless community members?
Right. I think I could take a stab at this one at first. And so I think I'd just like to report first that we've had no cases in the homeless community related to COVID, so that's a plus. But at the same time, we're trying to be as proactive as possible with our outreach and efforts to reach that population. We're making sure we're communicating with all our partners to get the information out, to get our informational tools out there. And we're doing our best to surveil the situation to make sure that if there's an issue, we can nip that in the bud and triage to our resources as necessary. So I think the key here is that we're trying to do as best as we can to coordinate, to talk, and to make sure that we have a handle on the situation.
My second question is, what are some of the strategies that you are going to be using or that you're already using to help ensure the safety of this population?
Well, I'll go ahead and take a stab at that. We are taking a proactive approach to serving the community that doesn't have stable housing. One of the things we're doing is putting processes in place so that if we at some point do identify someone from the homeless community that may be suspected of being positive for COVID-19, we want to have a plan in place for ways that they can isolate themselves given that they don't have stable housing at the moment. So those are processes that we're currently putting in place. One of the other things we're doing to be proactive is working with our community partners to go out into the homeless communities and sort of do general assessments, just kind of triaging and checking in with them to see if anybody is presenting symptoms and may need medical care or testing. And so that's been working well. We are currently partnered with Cuya Delta Street Medicine Program, and we're hoping to partner with some other agencies in the community to serve all of the small pockets within the Tulare County region.
And just to add one thing to that, and I think that one thing that's been in the news recently, locally and from the state and federal government, is that there's the opportunity to lease up hotel space for folks impacted by COVID, including the homeless community who might need to be quarantined or might need some additional surveillance. So what we're doing with that is working our best to work with local hotels to figure out the best opportunity to have those sites and have those folks there. And so we've been deep in conversation with several hotels. I'm happy to report that those are looking good. When we have some further deals, we'll be happy to share those out. But I think the important point to remember is that it's not our goal to house the entire homeless population. With this funding we're getting from the state to do this, it's very limited. So we're making sure to work with our community partners to place in there the folks that need it the most and make sure that we're doing our best to reach that population.
Thank you. For my third question, I'd like to know about any educational tools that have been created to ensure that the homeless community members know what's going on and what the situation is.
In addition to the street medicine team from Cuya Delta and the triaging, we have some messaging that's gone out to some of our providers in the community that serve the homeless community. And that messaging is geared so that not only is it helpful for those providers in serving the homeless community, but it's also helpful as informational flyers when they do outreach to that community. And it's presented in such a way that's also helpful to those without housing at the moment.
And just to add to that, to help get our information out the best we can, our public health department recently hosted a webinar, a conference call with members of the Kings Tulare Homeless Alliance, which basically includes most jurisdictions and all local homeless service providers. just to get some information out there about what we're doing for COVID-19, what the best practices are for COVID-19, to field some questions that folks might have. It's been our ongoing goal to make sure that what we know is being out there in the community. I think another thing we have in the books is to set up regular conference calls with groups like the Homeless Task Force, just to keep them in the loop with what we're doing and to field any questions or needs the community might have.
Now, you've mentioned the Homeless Task Force and Homeless Alliance and different providers, and obviously those are links to our homeless community members. Can you talk a little bit more about who these links are and what they're doing?
Sure, I'll take that, Tim. So the Task Force on Homelessness was established probably 3 years ago by the Board of Supervisors. So we've been partnered with them for quite a while, trying to attack this issue of homelessness that's widespread at this point across the state and across the country. They are working closely with us and our community partners like King's Tulare Homeless Alliance. We're also working closely with law enforcement agencies, medical facilities, our public health department. We're in contact with the state pretty regularly to keep up with new protocols that they have issued. So everything we're doing is a partnership, and every player is key at this point. And I think that speaks to how we work as a community in Tulare County. It's more of what we do. Just having to have more of a focus right now on this very particular issue to make sure that our homeless community is not left behind in the way we serve all of our community in these uncertain times.
Definitely uncertain times. Is there anything that either of you would like to say as a last statement?
Yeah, Tammy, I just would like to add a big thank you to everyone within the agency who is working so hard on these issues. A big thank you to all of our providers who are doing such a fantastic job of working with us and working on these issues. And a thank you to the community to being informed, taking the time to listen about what we're doing. And just know that we're doing our best to respond to this crisis. We're in uncharted territories, as you all know, but we will do the best we can to serve this community and serve our local homeless population.
Christina?
I just think it's important to remember that we're a community that cares about all of our residents. And so we're doing the best we can to not forget those who may be overlooked at times and put things in place so that they feel cared about as well.
That's a great message. We definitely don't want anyone to be left behind or feel like they don't understand what is going on right now. So thank you for being with me today, Christina and Chaz, and thank you, Tulare County.